All right. About Dr. Harshal, Harshal texted me like he get to know about the course and all that stuff, and he wanted to join, but he had very less. Like how many days you had before your exam? One and a half or something like that?
Yeah, 1.5 months. Of that,
Yes.
I utilized, I think, only 1 month I utilized properly.
Yes.
For
Okay.
15 days, I had gone to Italy for a conference.
Yes, true. All right. So Dr. Harshal is a very, very professional, and he is an excellent candidate, very knowledgeable, and he attended few mocks. And when he attended, and by his like when he was giving the mocks and everything, I was so amazed, and I said like, "You are going to pass this. Don't worry." Okay, so after the result, again, Dr. Harshal called me and said, like, I passed. Okay, and I was so happy because he didn't have that much time, and I was a little bit like, nervous about his knowledge, but he did it very nicely. All right, Dr. Harshal, it's all yours. Share your experience for the future candidates, please.
Yeah, sure. So thank you very much. You are too kind with your words. Thanks a lot for that introduction. So yes, I have to tell everyone that I found about Atik sir's class from Dr. Samir. I had gone to Kolkata for that RCS workshop. So that's when I found about Atik sir, and I joined in as soon as possible. And he was very sweet to take me in on the course, despite me having some issues with my financial status. So after that, I started attending his mocks. So I was not a regular student as such, but I made sure that afterwards I went on and saw the recordings. So I think I've seen all of his recordings on 2x for most of the times. So that's when I attended his live session. I was not able to recognize his voice for some time. So
That's
yes,
true.
yeah. So that had happened to me. But all said and done, it's all the mocks which I did. And also the sessions which he had taken. I saw almost all of them once, and the ones which he insisted on that we should see, I saw them at least twice or thrice. Apart from that, what I would say is take part in to, like participate more in mocks. I always felt that I would read everything and then participate in mocks, but that's not true. How much ever you have read and how much ever you have read in the class, at least revise that and attend the mocks. That gives a whole next level of boost of your confidence. So once you do that, then the exam is just another mock. It's nothing else. So and I must tell you that you should not be so worried about what they'll ask in exam specifically because everything is from source notes. So I've had people asking what to refer and what not to read. So personally, even I think I was lucky in this matter that I did not have much time on my hand. So I just blindly followed Atik sir, and that was my luck, I guess. Because had I had time, I would have wandered around and looked into Turkey notes or maybe some other notes with classes which I had joined before. There are n number of notes. I don't want to name them, but I just blindly followed what is there in Atik sir's notes. At times, there were a few questions which are out of the box, I felt, and are not there in the notes. So I went on to other notes, saw them, and then came back to Atik sir's notes and saw that I did not read them properly, and that's why I missed on the parts of those notes. So it was already there in Atik sir's notes, but I didn't see them properly, the questions and the answers. So basically, all the notes are almost at the same level. It's just that you have to take a guru and follow that guru with whole faith. I would not say blind faith, but whole faith. So I think Atik sir's classes helped me with the anatomy per se. So the knowledge collection, I think I was always a bit weaker on the knowledge part. So that I'm very thankful to sir that that part was taken care of by the videos. And rest of all those ACE, SCC and everything is bang on. As in, you don't have to do anything else. So when they ask me questions in my critical care stations, I was just answering what was there in source notes. Ditto, same to same, line to line, page to page. And they were just ticking it off. As in, they asked me one question and I answered this, did to answer what was there in source notes, and they just ticked off, tick, 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 tick. There was one examiner who was a bit careless, and I could see him marking during the exam. And usually these case sheets are such that they have the question written over there and they have the answers written below it. So I must tell you that let's just keep this in this group and this meeting. But I must tell you that all the answers are almost same. What is there in the notes with the line and with the words same to same. What is there in source notes. So you don't have to go anywhere else. You don't have to look into any other notes. You don't have to join any other mocks because I have seen people from other groups and other classes come and join our mocks and do our mocks, and they have benefited from more. Most of them have benefited from our mocks better, and I think sir knows about them. After the sessions, they usually say that this was the best mock that they have ever seen. Am I right, sir?
Yes, yes.
Yeah, so that is such a, as in, that is such a proud feeling that having found somehow the destiny played its way, and I found Atik sir. So I can never thank him enough for this. Specific doubts about the examination day. I think you should not worry too much about the exam day and just go with chilled mind and just believe in what you have read. Revise as much as you can. And I had specifically asked sir at least five, I think 1 week ago, I had asked sir about what has to be done specifically and what has to be revised. I think sir would be telling you that I have a list of it. If anyone wants it, I can just give a photograph. It's basically, I just asked sir in one of the classes what are the topics that we should be doing. And even in between classes, sir usually tells you that if you have last day and if you have only 1 hour to revise something, this is something I would prefer to revise. So those small points I did keep in mind. And as I told you, I didn't have much time to study. I utilized the time with all the important points and important notes what were there in first classes. And yes, regarding the exam day, just go with an open mind. Don't think about answers too much. Listen to the questions carefully. I started with the skills part first, so I was lucky. I started with the angry patient part, and that's where my mock came into play. So that's when I actually realized that the mock had effects on my preparation, and I hadn't done mocks much thoroughly. I did the communication parts with sir, but I saw all the mocks which were there in the previous part because I knew I was falling short of time. So I had seen sir do mocks last time with Samir sir and others. So I think Sanjeev sir was there, Sandeep sir or Sanjeev sir. So these that batch was also awesome. I mean, they had questions which I don't think so I had ever had in my mind. So when Atik sir explained their questions, they had those ortho station questions and doubts, which were again helpful for clearing all my doubts. So yes, I started with the communication part first. So that's how I kind of had a cool start to my station because communication was something I was confident about. So I just went in, I had that patient, angry patient, pacified the patient. Then next station was clinical examination of cranial nerves. So that was quite easy. You have everything written on the outside part of the station. There's a stem written, and they specifically tell you that you don't have to do cranial nerve examination of this. Just perform cranial nerve examination of a patient who has had a headache, and they will either tell you that this cranial nerve examination, or else they'll tell you that don't do these cranial nerve examination. Either of that. So it's not that will I get time to do all these things, and you don't have to worry about all these things. It'll just come to your head over there. The problem is we think of it in such a order that we'll do one, two, three, four, five. Over there, they'll tell you do first, second, do third, fourth, and then people have jumbled up over there, wherein people have started with first screening of examination. Then the examiner tells them that you don't have to do this; just go to the specific parts. So that shouldn't happen to you, and that is quite possible that will happen to you because there is a lot of stress going on in the exams. This exam is so nicely conducted that you'll enter, and then next thing you see is you'll realize it that the exam is ended. So it's so fast. Everything goes on so fast, and you just answer questions. It's there in the back of your mind. You just answer them, and it just finishes. You'll never realize when it started and when it ended. So the only thing is that you should go with a cool mind and your whole brain should be clear from all other worry and thoughts. Just listen to the questions and answer them properly. Apart from that, I don't think so. Anything else has to be done specifically. Just follow source notes. That is one thing I'll tell everyone. And be cool on the day of your examination. Revision, I have told you what the sir has a specific list of questions and topics to revise. Just take those from either me or the sir will be telling you, I'm sure. So just do that, and rest all will be there. And I would suggest you all that you at least do reading twice and revision twice. As in, read once and
Dr.
revise
Harshal,
twice at least.
everyone is not that much like, super genius like you.
Arey, no, sir.
So
No,
that is
at least that's why I said at least.
everyone don't hear Dr. Harshal. Okay, he is a super genius. Okay,
Arey, no, sir.
just do the revision at least 4 or 5 times. Okay, before your
Okay,
exam.
4 or 5 times,
Don't
sir.
take the risk.
We'll edit this part. We'll edit this part.
Please don't take
Revise
that
at
risk.
least 4 to 5 times.
Yes.
At least 4 to 5 times. Yes, yes, yes. I'm so sorry.
All right.
So, anything specific you guys want to know?
Yes,
I'm
please ask.
happy to. About the gloves, someone was asking. So, yes, you have to wear gloves. And actually, the RCS people were irritated the next day. First day, people were fumbling with putting on gloves because once you use sanitizer a lot of times, then your hands become a bit soggy and the gloves won't go inside your hands. So, people were struggling with putting on gloves. So, they had specifically told us that don't use sanitizer too much. We will understand. You just try and push it twice, and we'll understand that you're washing your hands and you're using, but don't like pour it too much on your hands and show it just to show it to us. Like make it visible, but don't make it too obvious. So just show it to them that you are washing hands, and you can also talk while you do that. Because second day when they had a session for us, they usually you have a briefing before your exams. They told us specifically that you don't have to pour into a lot of sanitizer on your hands. And while putting on gloves, don't be too anxious if they are not going inside your hands. You can just tell them that I'm putting on gloves, and then they'll ask you, okay, fine. If it is not going inside your hands, it's not a crime that you're committing. And you can take your time and they'll go ahead with the questions.
All right. Anyone wants to ask any questions to Dr. Harshal?
Okay, Dr. Harshal, I'd like to ask that the sanitizer will be given on the gate or inside the station?
The sanitizer is kept everywhere, outside the station, inside the station. It's at the gate. Like there are like 50, 60 bottles of sanitizer kept over there. So you don't have to worry about it. And they'll specifically tell you, now you can sanitize your hands. Now you can read the stem. So once you go inside, there will be a room. There will be 6, 7 rooms. You will be standing outside one of the rooms and you will be facing away from the room. You will not be facing towards the room. You will be facing away from the room. There will be 1 minute given for everyone to stand over there. After that, there will be a ring of bell which will say that now you can turn your back and see the stem. Stem is the part which is written, the question. The question you will have 1 minute to read about. After reading, there will be another bell. Now you can enter the room. After entering the room, you have to show that I am sanitizing my hands or washing your hands, whatever it is. So you'll show it to them. And you have to make them realize that you're doing it. Okay. After doing that, while doing that, you will rub your hands and you tell them, hello, good morning, my name is so and so. Sorry, my candidate number is so and so. And then do you have small strips of papers? Those are like barcode stickers with your number written on it. You have to hand it over to them. So that's how the whole scenario starts. And then your question answer session and everything. Now, then again, after going inside, as Alom sir told you, that after going inside, they'll ask you. In some stations, they'll ask you, have you read the stem carefully? Are you comfortable with it? Can we go ahead? That's what they'll ask. Now, this thing, if you're not read the stem properly, you should again go inside. And if they ask you, or even if they don't ask you, you can ask them that, sir, ma'am, I want to see the stem again. Because in one of my critical stations, it happened so that I didn't get enough time to read the stem. I went inside and then I started answering questions because I knew that the stem was the same thing which I had practiced. But there was a tweak of 1 or 2 things. So she asked me specifically, have you read the stem properly? Do you mind going back again to the stem? That's when I realized that maybe I'm missing some part. That time I again went back to the stem. I read it completely. So don't fake. If you're not seen or read it, just tell them that I've not seen it. They're super cool with you and they're very patient with you. So no one is going to punish you for not reading it in 1 minute. Everyone knows that it's a very less amount of time that has been given to you. I hope that answers your question.
Someone asked you, like,
Hello?
do you need to tell about tell your candidate number at the phone call station?
Yes, yes, yes. They'll ask you specifically. So in my phone call station, what happened is I directly went on to the station. I started talking about the station, but then he only interrupted me and asked me, before we start, do you mind giving me your candidate ID? That's when you don't give your sticker. That's the only station where you don't hand over your sticker. Rest all of the stations, they'll ask you for the sticker to be given. Sticker with your candidate number. It's all given over there. Also, one more thing, this sticker business, it becomes a bit clumsy affair because it's a sticker. You remember those school book stickers of name which we had with the pasty end on one side and name to be written on the other side, somewhat like that. So it becomes a clumsy affair when you try to pull it off the sticker paper. So what you can do is when they hand you over the sticker sheet during your preparatory phase, as in during your briefing session, what I did is I folded it from two sides. So after folding it from two sides, it popped up from both of the sides. So I did not have to struggle removing the stickers after every station. So I just use that one thing. That is one small thing, small what you can say trick that you can use. Because first day many people struggled in removing the stickers. Some of them forgot to take the stickers. So that is one thing you should do. Just fold them so that it becomes easier for you to remove the stickers on time. And yes, there was a phone call station with the phone over there and number was written over there. There's in these in the tricky parts of the stations, like in phone call station, and even in the preparatory stations, the rest stations which you have, there will usually be someone standing outside your station who will tell you that okay, now you go inside. After going inside, this is the phone number. They'll only brief you that this is the phone number. Once you have read about it, just give a call on this number. That's what it will be. No, there was no screen like TV. It was just a phone.
Hi, Dr. Harshal. Thank you for
Hello,
your
hi.
tips, like useful tips as usual. I had this question regarding equipments, like we'll be given some equipments according to the station, and if they are not accessible, like if the patient is sitting somewhere far and your equipments are somewhere like located in another location, can you move it? Can you take it near you or something? Or do you
So
have to run about?
this is regarding the sessions of abscess drainage and all. I'm supposed, right?
Yeah, right.
Okay. So this is these rooms are not too big. These rooms are just small rooms. Okay. So the patient will be lying on one corner of the room, and the other part of the station, as in the equipments which you're talking about, will be just at the leg end of the patient. And also you'll have one male nurse or chaperone, whatever you want to say. That person will be there. So what happened is, once I entered the station, I sanitized my hands and I said that I would ideally want to do scrubbing. Then the examiner then and there only he said that okay, we assume that you have scrubbed your hands, you're putting on your gloves. Because they want to assess you more on the skills part rather than on these parts. It's I think that was an examiner bias. It won't be in every case, but ideal would be you would say that I want to scrub my hands and take don on and put on gloves. So he just told me that yes, you have put on the gloves. This is your nurse for today, and he'll help you out. So I told them that I want to have an artery forceps and one mosquito and again all those equipments. So he had already prepared the trolley for me. So I just checked. He said that here is a trolley and here are your instruments. So I just checked everything was there. As in forceps was there, blade was there, part handle was there. I just told him, okay, fine, all these things are there. Now I would want to go ahead and proceed with all those things. I would want to take consent of the patient. I would like to explain the procedure. So they said that no, you go straight away go to the station. Now this was a tricky part. He told me that the consent has been taken, and for the explanation part, he didn't tell me that it has been done correctly. And when I went on to tell the patient, he said that you go ahead and do the procedure and tell us. So I made it a thing that before like when I was anesthetizing and all, while doing that only, I explained the procedure to the patient. And while doing it, I was talking to the patient and I was telling about the post-op recovery and what all precautions the patient has to do, what next things are the patient is supposed to do. So the questions which were supposed to come after my station, that were answered then and there itself. So they didn't ask me any questions after the procedure. They just saw my procedure, and because I think some of them asked people about the Langer lines. So be careful about those, because what happens is we try and just Google the Langer lines. Just look it in through some text, proper text, and then quote about the Langer lines, because there are two types of lines. There are Langer lines and there is resting skin tension lines. Both of them have a bit of difference in their orientation. So what happens is everyone knows Langer lines. No one looks for resting skin tension lines. And when you Google Langer lines, most of the photos they confuse you with both RTSL and Langer lines. So some orthopods were there with me. So they, by mistake, I think they told about the resting skin tension lines, and that's when the examiners got a bit cranky about that. How can you take incision like this? And I think they have given less marks for those stations for my fellow friends. So that is one thing I think you should take from that station.
Thank you.
No problem, Sanika. You're doing a good job, by the way. I just saw that you're taking your own mocks, and all of you guys should
Yeah,
join
it is just for
Sanika.
practice.
Yeah, I know that's a very nice thing, actually. Even I thought that I would do that someday, but my thoughts have been thoughts only. You're doing a good thing. Nice.
Thank you.
All right.
I
Anyone else want to ask anything to Dr. Harshal?
think I chatter a lot. So I don't think they want to ask
I would
anything.
like to know, like, if it's a hybrid stations, are there hybrid stations like in COVID era, or is it all live stations?
What exactly do you mean by hybrid station?
The examiners are there from UK, and there will be a TV screen or a computer screen through which you would be communicating with them, or is it like in COVID era we used to have examinations done via
So
like telecommunication? Yeah.
They briefed us
I
about
heard
this
that.
thing.
Yeah.
Yeah, you just
No,
finish your
I mean,
question.
like,
I think I can answer the
yeah,
question.
I mean, like,
The
oh,
thing
okay,
is,
sure,
RCS England. RCS England is only conducting hybrid station in Delhi and Kuala Lumpur right now. Edinburgh is not conducting any hybrid station. There are no TV screen, and one is going to appear and going to show you some anatomy picture. Is not going to happen in under Edinburgh. But RCS England is conducting in Delhi and in Kuala Lumpur. But I think they are also changing it to regular station right now.
Yes, hybrid
Right.
station is not conducting in any part in recent days, Dr. T. So you are going to have real persons in front of you.
Yeah, definitely. I think we had if I may, actually we had a discussion, the briefing which goes for the RCS people first. During that briefing, they told us that we are following COVID protocol. That's why we are doing those sanitizing things even after the stations. So apart from the sanitizers which are kept inside the station, there are sanitizers outside also. Once you leave the station, you're supposed to sanitize, and once you're entering the station outside after before that 1 minute which you get to read the stem, that time also they ask you to sanitize. It's not mandatory, but that is the only COVID protocol they're following right now. That's what they said. So I think that's the link to your question, that they have stopped following COVID protocol. Only thing they're following now is sanitizing your hands frequently. That's all.
Sir, may I interrupt? May I interrupt? Actually, in Delhi we had hybrid exam. Delhi we
That's
had
what I think.
hybrid.
Yes, that's what I said. That's what I said.
Yeah.
Okay,
But
Dr.
I think
Harshal.
everyone, Atik sir told us that everyone is going to change to normal.
Yes.
I think expect
and also
real patients.
when you are going to book your exam, it will be written whether it's a hybrid or it's not a hybrid. Okay, so if it is written that's a hybrid, and mostly it's for the England, as Dr. Alam said, then it will be a hybrid. Other than that, no.
Dr. Harshal, even like during the clinical examination, what was the outfit of the patient? I mean, for example, you had varicose veins, right? So for that?
Scrubs. They're all in not OT scrubs, the hospital scrubs.
So they are very quick at doing things, like
Yes.
whatever. Okay. So
Everything.
whatever
Because
we'll ask, they'll quickly respond.
They
actually,
will
there was a
respond
language
even before you ask.
That does happen. There was a language barrier, but as soon like if you're the first candidate, maybe there might be a bit of pickup. But if you are like third, fourth candidate, they know that they have to expose their chest. So I had a serious station, so they knew that they had to expose the chest. So even if he did not understand my language, he started unbuttoning his shirt.
Oh,
So yes, they do understand, and I don't know about other people, but Edinburgh people are good. They have people and translators over there, so they'll just translate quickly whatever you ask.
okay. Thank you.
Yeah, and his angry patient
So in terms,
situation. Yeah, go on.
yeah, in terms of like communication over the phone call, was it difficult to catch their pronunciation, or was it Indian consultants?
My consultant was an Indian, so yes, but don't worry,
Okay,
they
because I
speak.
believe some are having really heavy accent and it's difficult to catch over the phone. So
Okay, so no, so these people are fixed, right? So if that guy was there on the phone call, that person must have been in person also in other days during other exams. So there were few people. One was, I think, from somewhere from either China or some side. So his accent was also understandable. There was one lady who was of proper British. Her accent was also understandable, and they make sure that you understand. They'll speak very slowly. They'll speak word to word, and mind you, you have a lot of time. Like these stations, anatomy stations, and all, you have a lot of time. Not maybe not the skill part and critical care, but anatomy station, they'll go very slow. They'll tell you, have you understood? They'll confirm, and they'll make sure that you understand whatever they're saying. So accent problem, I don't think so. You'll have as such. You need not worry about the accent problem.
okay.
All right,
And
Dr.
an
Harshal.
angry patient, you don't have to confirm you are a Mr. I think
No, go
Atik
ahead.
sir has
Give
told.
the answer. Give the answer.
Yeah, no, you don't have to confirm that you are Mr. Because this patient is someone you've known, and he is angry about his operation being cancelled. So you don't have to say confirm his identity. You just have to go ahead and say, "Hi, John, how are you?" I like then he'll pounce on you. Like, he pounced on me. Is my can I get operated now? Can I come with you? I just have to tell him that I know you must have been starving, and can I get you something to eat or drink, something like that. You don't have to confirm, or else he'll get angry.
All right.
Am I right, sir?
Yes. Yes.
I remember the day like you pounced on
Yes. Yes.
one of our
Yes.
colleagues.
Yes.
Also, Dr. Harshal, you told about you missing out on a STEM. Why was that? Like, why were you delayed? Why couldn't you
It
sit
was
in a STEM?
quite a big STEM. It was critical care station. I think it was, I don't remember what it was exactly, but it was quite a big STEM. Sorry.
Maybe the
So I
diverticulitis,
just,
diverticulosis, septic shock.
yeah, septic shock. Yes,
Mhm.
septic shock. So it was a big STEM written outside, and I
Because they
didn't
will
read
give
it.
all the things so that you
Yes,
can
yes.
understand.
Okay. So, like, basically, once you finish one station, you have to quickly rush out because your time for reading the STEM has already started. Something
No.
like that. No?
So
Okay.
you go inside, you finish the station, you come out. They'll say that your station has ended. You'll come out. Then they'll give you 1 minute to rest. Then after
Okay.
1 minute, that 1 minute they'll cut short once they start running out of time. They'll cut short to 30 seconds or maybe 45 seconds. But you'll have time to come out, think about what has happened, just make your mind clear for the next station,
At least
and then
breathe.
they'll give you breathe at least, yes.
Repositioning.
Yeah. And then think about the next station, and then they'll say that turn your back and now you can read the STEM. That will be 1 minute, and then you'll go inside.
Okay. Got
So
it.
you have time. You don't have to run around everywhere.
Okay.
All right. Thank you, Dr. Harshal, for sharing beautiful thoughts and everything. the ins and outs
Thank you
very
very
nicely.
no, thank you
Inshallah,
very much, sir.
when I will be going to Mumbai, I hope to see you there. Okay.
Yes, we have to meet. We have to meet.
Yes, hopefully we'll meet, and pray for me and all the candidates as well. Okay, thank you so
Definitely.
much. Thank you so much,
Thank
Dr.
you very much,
Harshal.
sir. Yes, thank
No,
you
you're
very much.
most welcome. Okay, so